We appreciate you being here at 3 o'clock. I know it's kind of late in the afternoon, but we appreciate all those that are with us today. Will the Secretary please call the roll at this time?
Senator Rocky Adams.
I am here in the district.
Thank you. Senator Kerr. Senator Yates.
I'm present by a district.
Thank you. Representative Bridges. Representative Frazier.
Present in the room.
Thank you. Representative Marzian. Thank you. Senator West.
Present from the 27th District.
Thank you very much. And Representative Hale.
Present in the room.
We have a quorum.
Thank you very much. With a quorum being present this afternoon, the subcommittee is constituted to do business. The very first matter of business that we have on our agenda today is the approval of the minutes of the last previous meetings, or of the last previous meeting, not meetings, but the last meeting. Are there any additions or corrections to the minutes of that meeting? If not, is there a motion for approval? There is a motion and there is a second. Without objection, it is so ordered. Again, I'll just ask those that are joining us today by Zoom, please keep your microphones muted until you're ready to speak. If you have a question for anyone that is a presenter, just let us know, and we'll try to get all the questions from members here and then those that are joining us by Zoom today. At this time, I'm going to have them please call the first regulation this afternoon.
Under Boards and Commissions, Board of Pharmacy, 201 KAR 2061. Staff suggested amendment.
201 KR 2061 amends to establish definitions, provide due process and notice requirements to licensees, permit holders, and registrants, allow the licensee, permit holder, or registrant an opportunity to respond, provide notice of the status of the investigation and of the findings of the case review panel, change the makeup of the case review panel to 3 board members, remove the administrative conference while increasing the settlement conference availability, create a settlement process through which the General Counsel and the Executive Director can consent to some settlement agreements for the Board, and add language that is required by the Board in signing a memorandum of understanding with the FDA to investigate and report to the FDA grievances involving adverse drug experiences and product quality issues from human drug products compounded in Kentucky. The staff suggested amendment amends various sections to comply with KRS Chapter 13A.
Whomever is joining us today from the Board of Pharmacy, would you at this time please identify yourself for the record?
Yes, thank you. I am Larry Hadley, Executive Director, Board of Pharmacy.
And I am Eden Davis, the General Counsel for the Board of Pharmacy.
Thank you, Mr. Hadley and Ms. Davis, for being with us today. There is a staff amendment to this specific regulation. Is there a motion for approval of the staff amendment? There is a motion and there is a second. Without objection, it is so ordered. Are there any questions from any of the members of the subcommittee for Mr. Hadley or Ms. Davis? It appears there are no further questions, so we thank you all today for your time. Please call the next regulation at this time.
Thank you.
Board of Examiners of Psychology, 201 KAR 26115, 121, 125, 130, 155, 171, 180, 185, 190, 200, 230, 250, 280, 290, and 310. All except 125 have staff suggested amendments, and the following also have agency amendments: 155, 171, 180, 185, 230, and 290.
201 KAR 26115 through 200 are being amended to add or modify, clarify procedures for the required scope of practice for licensed psychologists who hold the health service provider designation, licensed psychologists, certified psychologists, and certified psychologists with autonomous functioning, licensed psychological associates, and licensed psychological practitioners. Clarify that a licensed psychologist shall hold the health and service provider designation to provide clinical supervision for licensed psychologists, distinguishing clinical supervision from business supervision. Clarify procedures for grievances and administrative complaints. clarify the procedures for applications for licensure and temporary licensure, clarify procedures for clinical supervision of certified psychologist, licensed psychological associate, candidate for licensure, a credential holder sanctioned by the board, or a credential holder under disciplinary action, and clarify that this type of supervision is clinical, not business or administrative. Clarify procedures for licensure by reciprocity, procedures for granting licensure as a psychologist to an applicant licensed in another state, procedures for supervised professional experience, and clarify educational requirements. 201 KER 26230 is being amended to clarify examination and application procedures, clarify that examinations administered by the board are administered by 2 licensed psychologists, clarify that the applicant's detailed remediation plan in the event of reexamination shall include the process by which the applicant proposes to improve his or her performance on the examination, the time proposed to be spent on remediation, and with whom the applicant proposes to study or obtain further instruction. Clarify that an applicant may only take the structured examination for licensure as a licensed psychologist or a licensed psychological practitioner a maximum of 3 occasions, and provide a new application option of using the Psychological Licensure Universal System program and paying the fee established in 201 KAR 26160. 201 KAR 26250, 280, and 290 are being amended to clarify licensees requiring supervision, clarify the procedures for applications for licensure of licensed psychological associates and licensed psychological practitioners. 201 KAR 26310 is being amended to clarify procedures for telehealth, define telehealth and telehealth services, require a provider to document the telehealth service within 48 hours of the service and follow all documentation requirements of the practice, require documentation of the patient's written informed consent to the services and the provision of those services via telehealth, the right to refuse telehealth consultation of services, alternative to telehealth services, the right to receive information from the provider regarding services rendered, and that the patient's information shall be protected by the applicable laws regarding patient confidentiality, the right to know the identity of all persons present at any site involved in the telehealth services and to exclude any such person, and the right to be advised of and object to any recording of the telehealth consultation or services, provide an exception to written informed consent in an emergency situation if the patient is unable to provide informed consent and the patient's legally authorized representative is not available, and require compliance with state law regarding the practice of psychology where the client is domiciled or located at the time services are rendered. The staff suggested amendments to these regulations amends various sections to correct statutory citations, comply with the drafting and formatting requirements of KRS Chapter 13A, and make technical changes. The agency amendments to these regulations amends various sections to reference 201 KAR 26230, delete unnecessary provisions, make clarifications pertaining to the reporting period requirements for temporary licensed psychologists and the types of exams required for licensure and reciprocity, make technical changes, and comply with the drafting and formatting requirements of KRS Chapter 13A.
Thank you very much. Representative Marzian, did you get all of that? All right. I missed one of those. Would you mind running through that again for us, just for clarification there, please? No. Thank you very much. Whoever is joining us today, please identify yourself at this time.
I'm Leah Boggs. I'm General Counsel for the Department of Professional Licensing, and I'm one of the board advisors for the Board of Examiners of Psychology.
Thank you very much, Ms. Boggs. We appreciate your time today being with us. There are staff amendments to some of these regulations. Is there a motion for approval? There is a motion, and there is a second. Without objection, it is so ordered. And there are also agency amendments. Is there any discussion on any of the agency amendments? If not, is there a motion for approval of the agency amendments? There has been a motion and a second. Thank you. Without objection, it is so ordered. Ms. Boggs, would you like to say anything today?
I want to say thank you very much, and a particular thanks to the staff of the LRC. They did a yeoman's effort in the staff suggested amendments and agency amendments, and I appreciate it.
Thank you very much. They always do a tremendous job, don't they? Yes,
really they do.
Are there any questions from any members? Representative Marzian, go right ahead, please.
Thank you, Mr. Chair. I guess assume that these regs are in response to the psychology legislation that passed this session.
Some of them are. Some of them are on the review period. 4 would have expired had they not been updated and amended. And it was just time to look at all of the regulations. There's very few that weren't amended, so it updates the language. It clarifies new testing, new procedures. It clarifies the exams that need to be taken. So predominantly, it was just an update of the regulations.
Thank you.
Are there any other questions? There appearing to be no other questions. Thank you, Ms. Boggs, today for being with us. Please call the next regulation at this time.
Thank you very much.
You're welcome.
Board of Licensure of Marriage and Family Therapists, 201 KAR 32 035, and 060, all with staff suggested amendments.
201 KR 3230 amends to update fees for continuing education providers, including to increase the non-refundable fee from $50 to $100 for a single continuing education workshop and establish a $300 fee for a provider designated as an approved sponsor for continuing education for 2 consecutive calendar years. Delete the fees associated with single workshop classes and incorporate material by reference. The amended after comments version makes changes for clarity and updates the application for continuing education sponsor form. 201 KR 3235 amends to add a definition of 2 years of post-licensure experience in the practice of marriage and family therapy. Establish that supervision can be done via live video if both the supervisor and supervisee have met the educational standards in 201 KR 32110 Section 3. Establish when raw data can be used for supervision in a group setting. Update the number of supervisees a supervisor can have at one time from 6 to 12 and make technical changes. 201 KR 3260 amends to update and establish requirements for continuing education providers seeking approval by the board. Establish that approval is for the span of 2 years and that the board may audit at any time. Establish the list of courses the board will individually approve and incorporate material by reference. The amended after comments version makes changes for clarity and updates in application form. The staff suggested amendments for these regulations all amend various sections to comply with KRS Chapter 13A. Additionally, the staff amendment for 201 KR 3230 amends sections 3, 5, and 8 for consistency with 201 KAR 3260 that includes with domestic violence, elder abuse, neglect, and exploitation.
Thank you, Carrie, very much. Whomever is joining us, please identify yourself today for the record at this time.
Yes, sir. Kevin Winstead, Acting Commissioner of the Department of Professional Licensing and the contact person for these regulations. I'm also accompanied by the chairman of the board, Dr. Oak.
Yes, Sean Oak is the chairman of the board. He's present.
Thank you very much, Dr. Oak and Mr. Winstead. We appreciate your time today and being with us. There are staff amendments on these regulations. Is there a motion for approval? There is a motion, and there is a second. Without objection, it is so ordered. Are there any questions from any members of the committee today? The only question that I did you have a question? The only question that I would have on 32030, was there a specific reason that was moved, the fee from 50 to 100, or what was the rationale there?
I'm sorry, Dr. Oak, did you want to address that? Or
no, I'll let you go ahead, Kevin.
Okay, appreciate it. And my understanding is that the board changed really the structure and the number of programs that would be covered by an application. And so this covers, I believe that covered a year of an unlimited number of programs. So it was in relation to changing that structure.
So did that structure go to a 2-year, the fee would cover 2 years instead of 1 now?
The higher fee would cover the 2 years. That would be a sponsor, that would approve a sponsored entity to provide CEUs with the board's ability to audit at any time. We wanted to streamline and make it a lot more efficient for the process for CEUs and to open it up for more people to be able to provide services to the professionals in the field.
Okay, thank you.
Certainly.
Any other questions? There appears to be no other questions. I'm sorry, is there any? Yes, Representative Frazier, I'm sorry, go ahead, please.
Hi, thank you. Just following up, could you give a little more explanation? Because there's two different fees, and I just want to make sure that I'm not making an inference, because one fee is going from 50 to 100, and then apparently there is a new fee that is 300, and that's for the 2-year licensure.
That's correct.
Okay, and the 50 to 100 is for CEU courses?
Yes.
Okay, thank you.
Mm-hmm.
Again, thank you, gentlemen, today. Appreciate your time. There being no further questions, please call the next regulation.
Board of Alcohol and Drug Counselors, 201 KAR 35010, 2025, 40, 50, 55, 70, 75, and 80. All except 025 have staff suggested amendments.
This package of ordinary administrative regulations is mostly identical to the emergency amended after comments regulations that went through the committee last month, other than a few minor changes for clarity. All of these regulations amend to make changes to comply with Senate Bill 191 from the 2021 regular session that added the 2 credentials Certified Alcohol and Drug Counselor Associate 1 and Associate 2. Additionally, 201KR 35010 amends to include under applicant an individual who has applied for temporary registration or temporary certification, and change the number of board members needed for a complaint committee from 2 to 3. 201KR 35020, consistent with the recent legislation, establishes various fees for renewal, late renewal, and reactivation. 201KR 3540 amends to allow live synchronous continuing education presentations to count as in-person trainings. Additionally, 201KR 3555 through 3580 amend requirements for licensees to reduce from 2 years to 1 year the requirement for recovery by an applicant, streamline information for educational transcripts and billing, establish that temporary certification shall be for 2 years, increase extension opportunities, delete the 300-hour requirement for clinical supervisions, restructure, clarify, and update supervision requirements, clarify and revise requirements for inactive and retired status, and update material incorporated by reference. The ordinary amended after comments regulations for this package all amend to make changes to comply with Senate Bill 166 from the 2021 regular session by adding in the credentials of a licensed alcohol and drug counselor and provisions for clinical supervisors. The amended after comment versions make clarifications, technical corrections, and update material incorporated by reference. The staff suggested amendments for 201KR 3510, 20, 40, 50, 55, 70, 75, and 80 all make changes to comply with KRS Chapter 13A. 201KR 3525 is okay without further staff amendment.
Would you identify yourself, please, today, who is joining us?
Yes, sir. Kevin Winstead again. I'm also the contact person for these regulations and also accompanied by a board member, Karen Haskell. Ms. Haskell?
Ms. Haskell, are you with us today?
I'm here.
Okay. Please identify yourself if you don't mind.
I'm Karen Haskell. I'm with the Alcohol and Drug Counselor Board.
Again, thank you both for being with us today. There are staff amendments to these regulations. Is there a motion for approval at this time? There is a motion and there is a second without objection. It is so ordered. Would either of you have anything to add today? Anything you'd like to add on these regs?
No, sir, I don't believe we do. But if you have questions, of course, we're glad to answer those.
Any questions from any of the members? It appears that there are no questions, so we again thank both of you today for your time. Appreciate you being with us today. Please call the next regulation at this time.
Thank you.
Tourism, Arts, and Heritage Cabinet, Department of Fish and Wildlife Resources, 301 KAR 1 400 and 301 KAR 2 228. Neither of these have additional amendment.
301-1400 is being amended to update the publication used for fish kill damage assessment to the newest edition. 301-228 is being amended to change the timing of the season and season length to coincide with duck seasons.
Whoever's joining us from Fish and Wildlife, please come to the table this afternoon. Good afternoon, gentlemen. We're glad to see Fish and Wildlife back with us. We haven't saw you for a month or so, I think, but thank you for being with us today. Would you all four please identify yourselves, starting from my right and going across? Would you all make sure your microphones are on? Push the little button until the green light's on there. Go ahead, Mr. Commissioner. Start again there.
Commissioner Rich Storm.
Dave Drees, Acting Director of Fisheries.
Chris Garland, Wildlife Division Director.
Steve Fields, Legal Counsel.
Thank you, gentlemen. There are no amendments to any or the two regs that we have before us here today. Anything that any of you gentlemen would like to inform us on either of these regs?
No, sir.
Just a couple of well, not really a couple, but first off, I do want to do something. I think Commissioner Storm has got a couple guests with him today, sitting in the back there. I think he has his daughters, Phoebe and Avery Storm, are joining Commissioner today, and we're glad to have Phoebe and Avery with us this afternoon. We welcome you girls. Glad to have you in our meeting today. We're glad you joined us today. Well, Mr. Dreves, I could sit here and probably give an explanation pretty good on a fish kill, because I've been involved in a lot of those over the course of the years, worked a lot of those.
So you probably could.
Know what happens and know what has to proceed through that. I'm just seeing here on the summary, it says it amends to update the publication used for fish kill damage assessment. Is that basically a fish kill that would occur in a public waterway by something maybe unforeseen, some spillage of something? Is that basically what this is covering?
Yes, sir. Yes, sir. This is American Fisheries Society publication. It's a standard manual that's used for coming up with the replacement values for the fish that are killed in a fish kill.
And we have had several of those over the years that we've had to do that on. I realize that, and I know that has been an issue at times with different places around the area of the state. So is there a formula that is used, or is there a direct cost? How's that determined exactly?
There is a subsampling that takes place by our staff. Will visit and investigate the fish kill, subsample the amount of water. If it's extensively, if it's a small, obviously then they'll count every fish that's deceased. But anyway, they come up with an estimate of the number of fish and sizes that were impacted by the fish kill, and then this manual actually has a replacement value, what it takes to culture those species of those fish and of that size to come up with a replacement value.
When these occur, as they do from time to time, when these occur, are the individuals responsible? Is there pushback sometimes from those?
Yes, generally there is pushback. Frequently, I think the councils can speak to this, but frequently there's some settlement that comes about.
Okay, thank you. Any other questions today? I just had to give you some questions. But we do thank you all for being with us today. Appreciate Fish and Wildlife very much. You all doing a good job, great work over there, and it's a great entity for our state, and we appreciate what you're doing there. Thank you all very much for being with us today.
Thank you.
Being no further questions, please call the next regulation at this time.
Transportation Cabinet Motor Vehicle Commission, 605 KAR 1 215 emergency. This does not have additional amendments.
605-1215 emergency establishes fees and licensure procedures for licensed motor vehicle dealers, manufacturers, and businesses regulated by the Motor Vehicle Commission.
Would whomever's joining us today please identify yourself at this time or come to the table? Yes, sir, gentlemen. Come on up to the table. Would you both identify yourself for the record today?
My name is Trevor Earl. I'm legal counsel to the Motor Vehicle Commission.
I'm Carlos Cassidy, Executive Director of the Kentucky Motor Vehicle Commission.
Thank you, gentlemen. Today we are glad you're with us. We appreciate you coming to be with us today. There are no amendments on this regulation. Are there any questions from any of the members of the subcommittee today? I've seen that. I've noticed here that this is filed with an emergency clause as an emergency. Could you explain the reasoning for that?
Yes, sir.
Is your mic on, sir?
Green.
Is it green? Or pull it just a little closer to you, if you don't mind.
Yes, sir. The legislature approved a bill that took out the licensing as it was established in 1982. So, with the effective date of that bill, we had to do something to keep us in business.
Okay.
So we had to propose the emergency and move forward so that we didn't have also any legal discrepancies that might occur, and our legal counsel could speak to some of that.
Yes,
Go ahead,
sir.
Go ahead, sir.
Yes, HB 249 eliminated the statutory fees for licenses. That was effective in late June. As a result, there would have been no established fee for any license until such time as the ordinary regulations were approved. That's why it proceeded as an emergency. There simply wasn't enough time from the date that HB 249 was passed until it became effective to promulgate the regulation, allow the comments, and then the final approval of those regulations. And we don't have, the commission has no independent authority to set a fee outside of a regulation. So that was the sole reason for the emergency designation.
Thank you for the explanation. I understand. Any other questions? Again, thank you, gentlemen, for your time. There being no other questions, please call the next regulation at this time.
Thank you.
You're very welcome, sir.
Education and Workforce Board of Education, Department of Education. 701 KAR 5081. This does not have additional amendments. And 702 KAR 3060 with staff suggested amendment.
701-5081 repeals 701-5080 application for approval of alternative school-based decision-making model because provisions are being included in 701-5100. 702-3060 amends procedures for teacher payments to make technical corrections and provide for teachers attaining national board certification to receive an annual national board certification salary supplement. The staff suggested amendment amends the necessity, function, and conformity paragraph to comply with KRS Chapter 13A.
Good afternoon. Would you please identify yourself today?
Good afternoon. Todd Allen, General Counsel for the Kentucky Board of Education.
Thank you, Mr. Allen. We appreciate you being with us this afternoon. There is a staff amendment on this regulation. Is there a motion for approval? There has been a motion and there is a second without objection. It is so ordered. Do any members of the committee have any questions for Mr. Allen today? Mr. Allen, the only question that I would have would be concerning 3060 and actually Section 2 there, where it states provide for teachers attaining national board certification to receive an annual national board salary supplement. Is that a monetary supplement they would receive? Would that be a monetary?
Yes, Representative Hale. Previously, for many years, we have law in place that teachers who are nationally board certified would receive a $2,000 salary stipend, additional payment. And school districts can apply to the department for reimbursement of the amounts that they spend to provide those supplements to their teachers. However, that hasn't been fully funded. So if the difference in what is funded at the state level and the $2,000 had to be made up by the local Board of Education. The amendments to the regulation are to bring it in line with amendments that the General Assembly made to the statute that indicates the local board is to provide the amount that is provided by the state. Mm-hmm. And then if the local board wants to provide the difference to make it a full $2,000, they can, but they're no longer required to going forward.
Okay. And I would go on record as saying that's good. I think that's really good. Any other questions? No other questions, it appears, so thank you, sir, for being with us today. Appreciate your time. Please call the next regulation.
Labor Cabinet, Office of Unemployment Insurance, 787 KAR 1 360 Emergency. This does not have additional amendments.
787-1360 Emergency establishes procedures to waive overpayments of unemployment insurance benefits if the overpayment was made without fault on the part of the recipient and if recovery would be contrary to equity and good conscience.
Good afternoon. Would you please identify yourself for the record this afternoon?
Thank you. Erin Bravo. I'm Deputy General Counsel for the Labor Cabinet.
Hi, good afternoon. Buddy Hoskinson. I'm the Executive Director for Kentucky Unemployment Insurance.
All right. We thank you for being with us today. Appreciate your time. There are no amendments to this regulation. I know this has been an issue with several individuals in the past. Could you just kind of give us just a quick overview of really what's happening here, if you don't mind?
Yes, sir. So if someone received an overpayment between January 27th, 2020 through December 31st, 2020 with this, it allows them to submit the waiver request, which we have sent out under the authority of the Secretary. They have 30 days in which they are to respond to that waiver. We have sent out to date a little over almost 14,000, little under 14,000, which could be an estimated around $17 million that someone could do. Now, what they're attesting to is that it would be hardship for them to pay it back. And so once we get that back, then we're able to batch those through.
Thank you very much for that. And I know that speaking for myself, I can't speak for everybody, but I know a lot of the legislators have had constituents that have approached us with these concerns, and I don't really, I'm not questioning how that happened. I'm not questioning that at all, but I do appreciate the efforts that's been taking place, and I appreciate the Cabinet's efforts in trying to rectify those situations. Any other questions from anybody else on the committee today? Again, thank you all very much. We appreciate your time today for being with us. Please call the next regulation at this time.
Department of Workers' Claims, 803 KAR 2 181 Emergency and 803 KAR 2 182 Emergency.
803-2181 Emergency establishes employer requirements for reporting work-related health and safety incidents. 803-182 Emergency repeals 803-180 record-keeping reporting and statistics, which is now governed by 803-181.
Good afternoon. Would you please all three identify yourself for the record today?
Erin Bravo, Deputy General Counsel for the Labor Cabinet.
Robin Maples, OSH Standards Specialist with the Labor Cabinet.
Good afternoon. Chuck Stribling, Occupational Safety and Health Federal State Coordinator with the Department of Workplace Standards.
Thank you, sir. And ladies, we appreciate your time today very much being with us. There are no amendments to this regulation. Are there any questions from the members of the subcommittee concerning this or to either of the persons? It appears there's no questions, so thank you all very much for your time today. Please call the next regulation.
Department of Workers Claims, 803 KAR 25015. Staff suggested amendment.
This administrative regulation amends to update language to add the provision that the Commissioner may, after review of evidence and any recommended order, immediately issue a citation for a violation without conducting an informal conference, and to clarify the process after an enforcement matter is assigned to an administrative law judge. The staff suggested amendment amends Section 1 to clarify the term business day and various sections to comply with the drafting requirements of KRS Chapter 13A.
Good afternoon. Would you gentlemen please both identify yourself for the record today?
Yes, Robert Walker, Interim Commissioner of the Department of Workers' Claims.
Dale Hamlin, I'm the Assistant General Counsel for Workers' Claims.
Mr. Walker, Mr. Hamlin, thank you today for joining us in our regulation meeting today. There is a staff amendment. Is there a motion for approval? Thank you, Representative Marzian and Representative Frazier, for your motion and second. Without objection, it is so ordered. Are there any questions? Anything you gentlemen would like to add?
No, Representative.
Okay, thank you. There appears to be no questions, so we appreciate you being with us today. Thank you very much. Please call the next regulation.
Public Protection Cabinet, Kentucky Horse Racing Commission, 810 KAR 2001, Chapter 3001, Chapter 4001, Chapter 5001, Chapter 6001, 010, 020, and 030, all with staff suggested amendments.
810 to 001, 3001, 4001, 5001, and 6001 revised definitions. 810-6010 revises procedures for exotic wagering. 810-6020 limits provisions to live horse racing and aligns the definition for takeout with commission as defined by 810-6001. 810-6030 revises requirements for parimutuel wagering. The staff suggested amendments amend various sections to comply with KRS Chapter 13A. Additionally, the staff suggested amendment for 810-6030 amends Section 37D to include drivers which were inadvertently omitted.
Good afternoon. Would you please identify yourself today for the record?
Hello and good afternoon. My name is Jennifer Woolsing and I'm the General Counsel for the Racing Commission.
Waqas Ahmed, Director of Parimutuel Wagering and Compliance.
Good afternoon. Mark Guilfoyle, Executive Director of the Horse Racing Commission.
Thank you all very much for being with us today. Just real quickly, I think we have been joined by Senator Kerr and Representative Bridges have joined us online at this point. So if either one of them have anything you'd like to, or any questions, just feel free to jump in, and if you have anything you'd like to say. There are staff amendments to these regulations. Is there a motion for approval? There is a motion, and there is a second. Without objection, it is so ordered. Are there any questions from the members of the subcommittee? Representative Marzian, please proceed.
Thank you, Mr. Chair. I was just questioning, where's Bob Hellringer today?
Are there any other questions today? Well, folks, this may surprise you, but even the chairman has no questions today. So thank you all for being with us today. We appreciate it. And all of you, thank you so much today.
Thank you, Representative.
Thank you, sir.
Please call the next regulation at this time.
Cabinet for Health and Family Services, Department for Medicaid Services, 907 KAR 1083 with staff suggested amendment.
907-1038 amends to authorize coverage for evaluation and testing services, regardless of age, if referred by a physician, to specify that a physician office visit is not required for the referral, and to remove the fee schedule from regulation and have that posted on the website. The staff amendment amends Section 2 to specify that the posted fee schedule shall comply with existing rate methodologies used by the department as established by state and federal law, and shall be populated by using the relevant portions of the Medicaid physician fee schedule as established by regulation.
Whomever is joining us, would you please identify yourself at this time?
Good afternoon. I'm Regulatory and Legislative Advisor.
I think we did not hear you, sir. Would you please say that again? I think we've lost Mr. Scott. Okay. Committee will stand at ease.
Sorry about that. Can you hear me now?
Yes, we can. Would you please identify yourself?
Can you hear me now?
Yes, we can, sir. Would you please identify yourself?
Yes. I apologize for that. I'm Jonathan Scott. I'm Regulatory and Legislative Advisor for DMS.
Thank you, Mr. Scott. We all knew who you were, but we just had to officially have you identify yourself for the record. Appreciate you being with us today. Always good to have you. Is there, or I'm sorry, there is a staff amendment. Is there approval? Motion. I'm waiting. Is there a motion for approval? All right. Thank you. Is there a second? All right. We have a motion and a second for approval of the staff amendment. Without objection, it is so ordered. Do any of the members have any questions for Mr. Scott today? Mr. Scott, there are no questions, so we thank you for your time today, and we look forward to seeing you again. Please call the next regulation at this time.
Department for Community-Based Services, 922 KAR 1490. Continuing under DCBS 922 KAR 2300 and 922 KAR 5020. They all have staff suggested amendments, and 922-1490 and 5020 also have agency amendments.
922-1490 amends to establish requirements for complete fingerprint-based background checks using the Kentucky National Background Check Program and to remove outdated language referring to kinship caregivers. The staff amendment amends various sections to comply with 13A drafting requirements. The agency amendment amends Section 18 and the material incorporated by reference to make conforming amendments.
922 KAR 2300 establishes the requirements and process for a child care program or new applicant to obtain emergency child care approval in the case of a localized emergency or declared state of emergency in Kentucky. 922 KAR 5020 amends requirements concerning credentials for certification to provide batterer intervention services, offenses that require denial or revocation of certification, specialty training in domestic and dating violence and abuse, qualifications for different types of providers, conflict of interest checks, interactions with victims, and intervention programs for groups and individuals. The staff suggested amendments for both these regulations amend various sections to comply with the drafting requirements of KRS Chapter 13A. Additionally, the agency amendment for 5020 amends the application for batterer intervention provider certification form to require that application be made to the Cabinet's contracted agency rather than to the Cabinet itself, to include a required affirmation page, to make a correction to the clinical supervision agreement for associate providers, and to update the form's edition date.
Good afternoon. Would you please identify yourself today for the record?
Good afternoon. My name is Laura Beacon, and I'm the Regulation Coordinator for the Department for Community-Based Services. And believe it or not, I am happy to be here today.
Thank you, Ms. Beacon. Anyone else joining you just by yourself?
I do have a few program experts on the line in case they're needed.
Could they identify themselves if they would for the record, please?
Sure.
My name is Sarah Vanover, and I'm the Director for the Division of Child Care.
My name is Rachel Ratliff, and I'm the Regulation and Legislative Liaison for the Department or Division of Protection and Permanency.
Ladies, thank you both for joining us online there today or with Zoom, and Ms. Beacon, thank you for being here in person with us today. There are staff amendments to these regulations. Is there a motion for approval of the staff amendments? There is a motion and there is a second. Without objection, it is so ordered. And there are also agency amendments. Is there any discussion on the agency amendments? There appearing to be no discussion. Is there a motion for approval of the agency amendment? There has been a motion and a second for the approval of the agency amendment. Without objection, it is so ordered. Are there any questions for Ms. Began or either of the other ladies on the regulation from the subcommittee? It appears, Ms. Began, that there are no questions, so please tell your guests we thank you for your time today. Please call the next regulation.
Under Effective Regulations for Committee Review, Cabinet for Health and Family Services, Department for Public Health, 902 KAR 212 Emergency.
Is there anyone joining us here today on this
Yes, sir. This is Julie Brooks. I'm the Regulation Coordinator for the Department for Public Health.
Yes, sir. Hi, and I'm Wesley Duke. I'm the General Counsel for the Cabinet for Health and Family Services.
Ms. Brooks, Mr. Duke, we do appreciate your time today of coming to joining us, probably on short notice, so we do appreciate that today so very, very much. This regulation 2212 with an emergency was filed when, please?
It was filed on June 16th.
And the governor's mandate was concluded on what date?
That was June 11th.
Okay, so on June the 11th, we had the first emergency mandate. I'm not sure what that was, but okay. And then we have this regulation filed on June the 16th. And as I have looked through this regulation, through this specific one that has been refiled on June the 16th, there's just a couple of questions that I have, if you don't mind today. During the last meeting of this regulation, the regulation that we were talking about at that point, it was speaking about the face coverings in places that they were to be worn or wherever they were to be implemented in the wearing of those. But as we come back to this particular regulation right here, and I'm just gonna read this in section 2. It says this. It says it requires a face covering if the person is in a health care setting or a long-term care setting. And in section 1 of this reg, it defines face covering. But I guess my question here, it doesn't really provide any really definition of what a health care setting or a long-term care setting is. My question is, how are you defining basically what a health care setting is?
Yeah, and I can speak to that first, and I think Ms. Brooks may have something to add to that as soon as I finish. We have advised different entities in the healthcare industry that there is a CDC document that discusses what a healthcare setting is, and we have pointed them to that. That is consistent with the governor's executive order as well as the emergency regulation is based upon CDC guidance. So we felt that it was appropriate to use that definition, and we have pointed them in that direction. Like I said, Ms. Brooks may have something to add to that.
No, I think that's a good explanation.
Well, I mean, when in your explanation, I mean, the question was specifically, what are you calling a healthcare setting? Or let me just go, and I'll come back to that. But let me go to this when it says long-term care setting. Would that be considered a nursing home? Would that be considered an assisted living place? Is that the same? Are both of those considered a long-term care setting?
They would be.
So that would actually include both of those nursing homes and no, go ahead. I'm sorry, I didn't mean to interrupt.
No. And I'm just a point of clarification. I know the traditional nursing home setting would follow. I'm not sure about assisted living. That's a little. So I don't want to. So I like to kind of pull back on that. I'm not sure where assisted living would fall in that. So I can, but I'm happy to kind of follow up with the committee with that answer. But right now, I would like to kind of. I'm not sure where assisted living would fall there. But the traditional nursing home, yes.
Okay, so really the traditional nursing home would definitely fall under that, but assisted living may not. Am I correct on that? Could or could not?
May not. I am not 100% certain on that, and I don't want to tell you something that something before I have a chance to confirm it. So I'm sorry.
Okay, if I can just go back and I hope I don't sound repetitive on the healthcare setting. Give me an example. A hospital?
Yes.
Clinic? I mean, medical clinic?
Yes. Yes, sir.
What about a pharmacy?
I think we have taken, well, actually, she was on the call earlier. We have advised the Board of Pharmacy that a pharmacy for example, a hospital pharmacy, one that's in a clinical setting, would in fact follow. However, your neighborhood independent pharmacy, your Walgreens, your CVS, they would fall more under the retail, and they would not be, they in fact would not be, no mask will be required. Sorry, apologize for that.
So a pharmacy that would be located in a traditional drugstore, as I would call it, that would not be considered a healthcare setting.
It's our interpretation is that would fall under more of the traditional retail circumstance. Now, but once again, if you go to your health clinic and they have a pharmacy within that's available for patients to use, they're on site. The mask would have to continue to be worn after you finish your medical appointment and you wait for your prescription.
If that setting was in a hospital or a clinic or something of that nature.
Yes.
Okay, but again, it is your determination of this that our local drugstore out there, the Walgreens, CVS, the local pharmacies, they would not, in your estimation, be considered as a healthcare setting.
I do not think so.
Okay, I just had some questions about that. That was just a question that as I look through this through the regulation. So can I say then, sir, that you're going on record as saying that is correct?
I think and in fact, I think we've had to. As you're not surprised to hear, other people have had the same question you've had, and we have consistently advised them as such. And I believe I have also reached out to the Board of Pharmacy. I've had some back and forth with them on this issue as well, and we've consistently, taken that position that in the traditional retail pharmacy, that the mask is not required.
Then I just have one other question, and I'll certainly take you at your word on that. What you just answered me there. Are there any exemptions for mandatory face coverings within this new reg?
No.
No.
So there are no exemptions. Did both of you answer no?
Yes.
Yes, sir. We both answered no.
Okay. I just want to make sure. So there are no exemptions for mandatory face coverings within this new administrative reg.
Correct.
One other question.
Yes, sir.
And I think I probably know the answer to this, but I'd just like to hear it. And businesses, healthcare facilities, entities, they do have the ability to establish their own policies, correct?
As to masking?
Yes, as to the mask regulation.
Yes, I mean, I know of nothing that would prevent any of those entities that you just described from I guess coming up with individual policies and procedures that would govern their day-to-day operation. But this regulation is a kind of a foundational document. But for example, to use our example we're talking about, there's no reason that a retail pharmacy couldn't require it.
The only other thing that I would have to say about this new regulation is I really don't see the necessary importance of it at this time. It seems like it just kind of confuses this issue. This is me, and I'm just speaking for myself. Or it seemed like it sort of confuses this issue of we have certain places that can set their own rules and regulations, and then other places don't have to. It just seemed like it could be a confusing thing to individuals. And that's just me speaking here today.
Yes, sir.
Any other questions? Anybody have any questions for either of our guests? Representative Frazier, please go ahead. Thank you.
Yes, thank you for being here today. I just have one question. How is the cabinet enforcing this regulation?
We have removed the enforcement language in this current E-reg that was in the other one. So there is no enforcement mechanism here. This regulation was promulgated and filed in to accompany the governor's executive order of June 11th. And obviously the language mirrors that. We are trying to protect these. And I think the last time I was with you all, we talked about certain vulnerable populations that the CDC, the Kentucky Department of Public Health, the administration wanted to protect. And that's the goal of this. And we have taken the enforcement language out of this.
May I ask a follow-up?
Yes, please go ahead, please.
So are there any fines or penalties?
There are not, ma'am.
Okay, thank you.
Any other questions? Representative Bridges, I think, is online. Representative Bridges, do you have a question?
I do, Chairman, and I appreciate it, and appreciate your testimony, Ms. Brooks and Mr. Duke, but I'm struggling here. We've got a rule and a regulation, but we have no enforcement of it. We have no penalties of it. And I understand you want to do good, but I really, this helped me understand why, I guess, because it's sort of convoluted and it leaves some possibilities for other entities to attempt to enforce this without having clarity. And that concerns me. Health departments could come in possibly and try to enforce this, and it's so subjective. I think it's going to cause a lot of confusion, and I'm struggling with the need for it, I guess, and please help me understand this.
Well, and I think what the intention was and still is going forward is we're at a point now where we are focusing our attention upon protecting, like I said, these certain vulnerable populations, people who are immunocompromised, elderly, people who have underlying health conditions. And I think it's our position also. The CDC guidance was pretty clear on that as on the federal level to kind of move toward doing that as well, to be targeted. So therefore, we felt that this was appropriate. Obviously, it completely mirrors what the governor's executive order is and where we are right now. I will be honest. There's been a little bit of there's been a gray area in about everything during the pandemic. I don't think I can get anybody to disagree with that. But we try to be as specific as possible and as narrow as possible, just to try to target, like I said, these certain places where we're trying to protect. And we've tried to make available, like I said, I know I've talked to certain groups, I've talked, and try to point them to guidance and point them to be able to define, what is a healthcare setting. So while there is always an opportunity out there for gray area and a bit of confusion, we have tried to be as targeted and as clear as possible. So I understand your concerns, but I think, but as far as what our intentions are, we're to try to be as specific as possible and to protect certain groups of people.
Another question.
Yes, go ahead, Representative Bridges. Proceed.
We have statutes that define healthcare settings and long-term facilities, and none of these were referenced in this emergency order. I think there's not enough clarity in it, and I really have to question whether we should if this is acceptable or not. And I'm struggling with this. We've had over a year of executive orders, and they have changed daily, if not hourly, at times. The people of Kentucky are very frustrated with this, and it's just like it's on a whim. And I don't mean to be degrading or anything, but uh, I'm starting to feel enough is enough. And each facility faces different situations. You've already told us that they can set their own precedent in these and their own rules and what they're willing to accept or not. I think we're all adults and we can make our own decisions. And I'm struggling with this, and I'm really having a time not finding this deficient, and I need some reasons why we shouldn't. And I've not heard them as of this time.
Well, and in response, I really don't have much to add to my previous response, except that at this point in the state of emergency and in the pandemic, with the onset, with the availability and the effectiveness of the vaccines, that it's very obvious to the CDC and all the public health officials that these certain specific groups need protection, and masking is one of the most effective ways to do that. And that's what we tried to do, is target those groups. And we try to provide as much guidance as possible, and we will continue to do so. There's nothing, and we will continue to do so. We'll talk to whatever group we need to talk to, and we will do our best to provide as much clarity as possible. But ultimately, the goal is to target and protect specific groups, and we feel this is the best tool to do that at this time.
Mr. Duke, may I, if I could ask you one more thing? In reading through this regulation that has come before us here, you've made several references in our conversation today to the CDC guidance. And if I'm wrong here, please correct me. Please correct me if I'm incorrect on that. Please correct me if I'm wrong. But I in reading this, I can't see as there's anything that the CDC guidelines is incorporated into this regulation. I haven't seen anything in there that shows their guidelines incorporated in this. And if it's there, please correct me, or if I'm wrong.
I'd let Julie answer that question. I think she is probably better suited to answer that.
You're correct. We did not incorporate the CDC guidelines into this regulation. As I'm sure you're aware, those guidelines change, and I believe it was Representative Bridges that said, things can change daily. And it would have been difficult to have incorporated one set of guidelines, particularly if those could have changed, very quickly.
Senator Adams, I think, has a question. Senator Adams, go ahead, please. Senator Adams, are you still with us, and do you have a question?
Okay, yes. And can you hear me okay since
yes.
I'm remote?
Yes, we can. Go ahead, Senator Adams.
This has been really good testimony. I appreciate the cabinet, coming before us today and communicating this latest directive. But my thoughts are with the with 77 that we passed this last session that mandated that we follow CDC guidelines. Does it kind of, I would think that it would make this this regulation moot, in the sense that we've already said you need to follow CDC guidelines as we move forward. And so I'm kind of wondering why we need this at all.
Well, and obviously without getting into a whole other area, there is, the effect of House Joint Resolution 77, I believe that's what you're referring to. The
Correct.
effect of that is currently before the courts, and how it affects the ability to pass emergency regulations, and how, and in regard to CDC guidance, And there's some questions there. And I think we can all agree that it is currently pending before the courts the effectiveness of that. And I hate to go back to it sounds like a broken record. It's just, we feel this is the best way to accomplish the goals of protecting the people of the Commonwealth and those certain groups. And yes, we do rely upon CDC guidance, but that is what CDC, that's why they put it out for. And like Ms. Brooks says, it changes as it needs to, as COVID-19 changes, as new things are learned and developed. So therefore, it's hard to pin it down on a daily basis sometimes. But we still feel that this regulation, mimicking and following the governor's order, is the best way to go about this mission of protecting these people.
Okay, Mr. Chairman, I just have two quick follow-ups.
Yes,
if that's appropriate.
That is appropriate, Ms. Senator Adams. Please go right ahead.
Okay, I understand that you feel the need that this is your best method to protect those vulnerable populations. Is there any evidence to present that these healthcare settings are not following current CDC guidelines, so that we are now forced to protect them? Or I'm just curious as to the evidence that we need to protect them and they're not protecting themselves.
I can anecdotally, I can say that, here in the cabinet, we have received a small number of reports to our Office of Inspector General that does licensure, that there are some healthcare settings every now and then we hear about not enforcing the mask mandate and not following the regulations. But I will say those are very, very, very few and far between. I think the evidence as we have it would support that most, if not, I don't want to say all, but most healthcare settings, most of our long-term care facilities, that they are in compliance. So I think that I can comfortably say that. But we do every now and then receive a complaint of a long-term care facility, a hospital, even of people not following the actual regulation as it's currently written.
Okay, and then I guess, and thank you for that. And then I guess my only other, and this is more of a comment rather than a question, is with the lack of specificity that is in this regulation as it relates to the CDC guidelines, I'm worried that if we do get some evidence that someone is not following it, that the response would be subjective in how we apply any sort of remedy. And I think the enforcement could be subjective. I think the application could be subjective. And I just, for the record, want to be on there that I'm concerned about that lack of specificity with regard to this new reg. Thank you, Mr. Chairman.
You're welcome, Senator Adams. Are there any other questions or comments? Representative Bridges, do you have another comment, please?
Yes, I do. I'm concerned about this, and in all due respect, Mr. Duke and Ms. Brooks, you both yourselves have acknowledged that there's some lack of clarity, and as Senator Adams said, specificity. So I'm sorry, but I feel at this time this is too vague. It's too nondescript, and I feel like I need to make a motion to find this deficient, this regulation.
Second.
So Representative Bridges, are you making that motion at this time, sir?
Yes, sir. Yes.
Okay, Representative Bridges has made a motion to find this regulation deficient. Is there a second?
Second.
There is a second. Is there any discussion?
Mr. Chairman?
Yes.
This is Julie.
Yes, ma'am. Go ahead, Miss Adams. Senator Adams.
One of the, I'm not speaking to the motion to find deficient, but I was wondering if the cabinet would entertain maybe a deferral so that they could add some meat to the bones of this, so that I think that so we can be a little bit more thoughtful in our discussion. And I don't know if those conversations have been had or not, because I appreciate where they're coming from, which is public protection and healthcare concerns, and I appreciate that. But I was just wondering if there's been any talk about maybe allowing the cabinet to add some more specificity to this.
Senator Adams, the committee will stand at ease for just a moment, please. Senator Adams, to your point, staff has informed me that due to the fact that we had just called this regulation today, that this regulation cannot be deferred. It is not. We're not able to defer it as is right at the moment. So since it has been called up, it cannot be deferred, and we will now go back to the motion that has been made for deficiency. And there was a motion for deficiency. There was a second. Is there any other discussion? So the question on this regulation, or on the motion, I'm sorry, is to find this regulation deficient. And all those in favor of finding this regulation deficient, when the secretary calls the roll, will vote aye, and those that oppose will vote no. And it takes 5 aye votes in favor of this motion for it to pass. So at this time, again, just to make everybody aware, aye vote is to find the regulation deficient. A no vote would be to not find it deficient, and it does take 5 votes in favor of the motion for it to pass. Would the secretary please do a roll call vote at this time?
Senator Rocky Adams.
Aye.
Senator Kerr.
Aye.
Senator Yates.
Nay.
Senator West.
Aye.
Representative Bridges.
Aye.
Representative Frazier.
Yes.
Representative Marzian. Representative Hale.
Aye.
We have 6 aye votes, so the motion carries.
So the roll call shows 6 members voting aye and 1 member voting no. Is that correct? The motion to find this regulation deficient has passed. If there being no further questions, I think that brings to conclusion the end of our agenda today. We will have announced to us at this time the next meeting for the next date for the meeting.
We have the next meeting scheduled for our traditional second Tuesday, which would be August 10th at 1 p.m. Does anyone know of any conflicts at this time with that?
August the 10th at 1 p.m. is the next scheduled date for the meeting. I think that's probably too far in advance for any of us to know right at the moment. But August 10th, 1 p.m. Thank you all for your time today. Appreciate all the members. The meeting is adjourned.